Guys, you may think that with each passing birthday, your heart turns the same age as you do, but in reality, your heart can sometimes age faster than you do. So, according to the US Centers for Disease Control and Prevention, half of adults assigned male at birth and 20% of adults assigned female at birth in the US have a heart that's 5 years older than their chronological age. So, guys, let's see how your heart ages over time, how to know if it's aging prematurely, and the ways to keep your ticker healthy and young. So, how do I know if your heart is aging prematurely? Because it's possible for your heart to age faster than your chronological age, you can get an idea of what your heart age might be through an online age calculator. It's a way to quantify your cardiovascular age based on different risk factors like the high blood pressure, past health issues, and the family history of any cardiovascular diseases. Well, aging hearts are more likely to have stiffer calcified arteries, thickened and stiffer muscle tissue, abnormalities in their conduction system, and dysfunctional valves. An older heart age or an increased risk for heart disease is obviously not what anyone is hoping for. But the good news is that knowing this information can help you and your healthcare provider prevent the future issues. So, guys, now let's see what are the risks associated with your heart aging faster. So, the factors like your health history can give you, your health provider, an idea of what age your heart is and your overall risk for the cardiovascular diseases. The genes you inherit from your parents may play a role, but the other lifestyle factors are also important. While some of this can't be modified, you are able to manage the majority of them. These risk factors includes first is chronological age. Heart disease risk begins to risk after age 55 as your blood vessels begin to stiffen and a lifelong buildup of plaque in the arteries starts interfering with the flow of blood. Second reason is sex. It has been found in studies that men get heart disease about 10 years earlier than women because females are generally protected by the estrogen until after menopause, when their heart disease risk begins to match that of the males. Third reason is family history. Your risk of heart disease is higher if your biological father or brother was diagnosed with it before age 55 or your biological mother or sister before age 65. Next reason is blood pressure. Blood pressure beyond 120 to 80 ages your heart. Next is cholesterol. The higher your cholesterol level, the older your heart becomes. Next is smoking. Any smoking raises the risk of heart attack even if it's only once in a while. Exposure to secondhand smoke can also be dangerous. So, next is weight and overweight. Overweight and obesity also tax your heart. Next is diabetes. Diabetes or pre-diabetes puts you at greater risk for the heart problems. So, guys, we know that most of the important way to prevent cardiovascular disease like arteriosclerosis, heart failure, and arterial fibrillation is promoting a healthier lifestyle throughout the life. So, how do we achieve this and keep our heart young and healthy? So, guys, it's never too late to reduce your risk factors and your heart's age. So, here are some of the things you can do to help your heart stay young. First step is take care of your chronic disease or conditions. Keeping your blood pressure in the normal range can minimize your risk. The same goes for the diabetes and high cholesterol. So, other diseases like the thyroid as well as some medications may weaken your heart. So, have regular checkups, follow your provider's treatment plan, and take your medications as prescribed. Second step is stay active. Your heart needs exercise to keep it in shape. So, exercise increases your heart's pumping power and helps deliver oxygen throughout your body. Regular exercise also helps keeps weight and blood pressure managed and reduces stress. If you have an illness or disease that makes exercise difficult, look for a modified exercise program that's more suited to your abilities. Third, I recommend trying to aim for at least 150 minutes of moderate intensity physical activity. For example, double tennis or the brisk walking. Next is keep a good diet. Another way to show care for your heart each day is by following a healthy diet. This is because many of our food's ingredients can help keep cholesterol and blood pressure levels balanced. But take heart, you don't have to eliminate all of your favorite foods. So, In fact, having a heart healthy diet may just mean incorporating more things on your plate, like the whole grains, leafy vegetables, and lean proteins. And I also recommend avoiding trans fats as well as consuming saturated fat, salt, and refined sugar sparingly. Next step is smoking. This is absolutely necessary to protect your heart, as tobacco is very addictive and quitting is hard. The average person tries 7 times before succeeding. So your chances of success increase if you use three different stop smoking aids simultaneously. So tell your provider you would like to quit and ask for a plan. It's one of the best things you can do to take care for your heart. So, don't drink a lot of alcohol. Reducing your alcohol intake is another great way to keep your heart in good shape. Excessive drinking has been linked to cardiovascular conditions like high blood pressure, cardiomyopathy, and a greater risk of stroke. Generally, it's best not to exceed more than 2 drinks if you are a male and no more than 1 drink if you are a female. So, not sure how much is too much. So, here is what generally counts as 1 drink based on the type of alcohol. So, canned beer is a 12-ounce bottle you can have. For wine, 5-ounce glasses is much. For distilled spirits like gin, rum, tequila, 1.5-ounce shot glass. So, if you are looking to change your alcohol consumption and don't know where to start, talking to your healthcare provider is a great first step. They can provide personalized guidance based on your health status and drinking habits. So, next step is get regular checkups. Sometimes your heart may need a checkup even if you don't feel like you need one. That's why it's good to get a regular exams so a physician can test your blood pressure, triglycerides, fasting glucose, and cholesterol, or just discuss any symptoms you may be having. This way, your healthcare provider can help identify heart problems before they cause any serious issues. And the next sign is step is don't ignore the unusual symptoms. While getting regular checkups is important, it's also crucial to listen to your body when it's telling you something is up. So if you develop any of these symptoms, contact a healthcare provider immediately. So guys, if you found this video helpful, kindly give it a thumbs up and subscribe to our channel for amazing health and wellness tips, and I will see you in the